is Kristen from Impact Fitness Nutrition. Today I'm going to show you the foam roller and how to apply that. It's great to use before the workout. It kind of just primes the muscles, gets them ready, increases your mobility, and it's also fantastic to use after your workout as well to just help to increase your recovery time, just taking care of those muscles. So I have a few different foam rollers that I use. This big one is what I first started off with. This is pretty good. It's made of all foam. It's a completely solid unit. It's very lightweight. So this is what I started off with when I first began foam rolling. This one is a portable one, which is really nice. You can easily pack this one when you're traveling, and also it's very easy to apply the muscles and just get a quick release in those muscles. So just think of, they call it SMR, self-myofascial release. Think of it as self-massage. Sometimes you'll hear that as well, that term. This is the most recent one that I purchased, and this is probably my favorite because, and I don't know if you can see it in the video, but it has these grooves in it, so it gets a little bit deeper into the muscle fibers, and depending on where your tightness is, I just believe that this foam roller gets a little bit deeper. You'll notice that it's hollow inside, it's made of PVC on the inside, and then they wrap it with this nice foam, so it's a very solid piece. Runs about $40 through Amazon, or some of your local athletic stores or running stores carries these as well. So I'm going to show you a few different body parts that you can use this on, actually several different body parts that you can use this on. So just for the sake of the video, I'm going to go ahead and use this one so you can easily see it as I do the different releases to my body. So first I'm going to start off with the lumbar spine, work into the thoracic spine, and we'll take it from there. So when you work the lower back, you're just going to lay onto it. You're going to arch your back, you're going to lift your bum, and just kind of support your body with your elbows, and you're just simply going to rock back and forth. Come in about 10 times or so where you're just doing a nice roll. And anywhere where you start to feel tension or a tightness in the muscle is where you want to stop and just roll it slightly in that area to kind of loosen up that tightness. And then you're just going to continue with that. Taking it onto the thoracic spine, the upper part. It's going to kind of arch your back. And again, you're just rolling, using your legs, extending and flexing as you take it back and forth. Now what I recommend in these bigger body parts is to do it in sections. This is a very large component, so if you take it in smaller sections, say just the very upper back, and just go back and forth. And again, wherever you feel that tightness, just stay on it for a little bit and roll it out a little bit more to try and decrease that tightness. Next part, you're going to work this side of the back, your latissimus dorsi, big muscle there. So you're just going to lay on it. You're going to bring one foot forward, and this foot is where you're going to have the weight, same with your elbow. You're going to lift your hip up, and you're just going to take it back and forth until you hit that muscle. This one can cause a little bit of added pain just because of the way that you're positioned and the amount of pressure that you're putting on it. And again, if you feel tightness, just stay in that spot, roll it out a little bit, and just reposition as needed to make sure you're getting. So as far as a pain level goes, on a scale of 1 to 10, it should be about a 4, so just a minimum to moderate amount of pain. If you start to experience anything higher than that, it's best to just stop. So that's the top And we'll go down to the bottom. I'll do the hamstrings. Hamstrings is a little bit more challenging to really dig deep into the muscle. So again, going back and forth, you can segment it. Your bottom, your butt is lifted off the floor. Your weight's on the palm of your hands and you're just going back and forth. So if you're not feeling this a lot, just go ahead and cross one leg over. That's going to give a little added weight to that leg that you're applying the pressure to, and you're going to feel a little bit deeper into the muscle and the fascia. My favorite stretch in the area that's most tight on me is my calves. So this one, again, you just go back and forth, starting off just in segments. I just go halfway up my calf and stop, and then just go back down to my ankles, halfway up, down. And again, wherever I feel that tightness, I'm going to try and roll it out a little bit more. So you can do one calf at a time, both. I prefer to do one calf at a time. And again, if you're not feeling enough pressure doing it that way, then you just put one foot on top and go back and forth, and you're definitely going to feel that. And then once you feel that you did enough on the bottom, about 10 rolls back and forth, you're going to take it to the top and just segment it out. All right, next part, I'm going to do the ITB band, the side of your legs. If you're a runner, you could experience tightness in this area. It's very common. So you're just going to position yourself, and you want to aim from the hip down to the knee is the length of your ITB. And this one can definitely get uncomfortable. So you're just going back and forth. Again, your front leg is in front, top leg is in front of you, and you're just taking it back and forth. And again, feeling that tightness, hone it in on anything that feels a little tight. Like I'm feeling tightness right in this area. So I'm just going to hang out here for a little bit and just roll it very, very small roll into that tightness. And you'll feel it loosening. And then you're just going to continue to do the release. That's for your ITB. And the last part that I'm going to show are your quads. So you're just going to lay on it. You're going to be on your elbows and just take it back and forth. Again, what I would recommend is just working small sections at a time, since this is a big muscle to be working. Just back and forth, about 10 rolls. Then you can hold it wherever you feel the tightness and stay in that area. So that's it. Just a brief overview of what you can do with the foam rollers. It's excellent, again, to do before your workouts to help increase your mobility, and it's also very beneficial to do after your workouts to enhance your recovery. Well, that's about it. If you have any